Glad to have you back. Now, breastfeeding babies for the first 2 years would annually save the lives of more than 8.2 million children under the age of 5 worldwide.
Yes, indeed. And that's according to the World Health Organization, WHO, and the United Nations Children's Fund, UNICEF. And as the world celebrates Breastfeeding Week, the United Nations is creating awareness on the criticality of early breastfeeding and its advantages.
Now, breast milk is considered to be a baby's first vaccine. It is rich with immune and non-immune components which resist infection and also accelerate intestinal maturation in a child.
Health experts say exclusive breastfeeding reduces the risk of diarrhea, pneumonia, and other infectious diseases in comparison to infants who drink other substitutes to breast milk.
All right, we have in the studio Dr. Opeyemi Oluwabiyi. She is a consultant pediatrician. Of course, she's here to shed more light on the importance of breastfeeding. Good morning to you, and thank you for joining us.
Good morning.
All right, how important is breast milk for a baby?
Breast milk is quite important in the life of any baby. In Nigeria, we're not doing as much as we should. But breast milk is a complete meal. In fact, it's been described as a complete meal because it has all the nutrients that the newborn baby requires to survive in the first year of life. It doesn't just have all the nutrients, it also it has antibodies, it has components that will help the gut to develop faster and better. And of course, as you're breastfeeding your baby, you also promote mother-infant bonding, and that is very critical. Now, the importance of breast milk is not only in the first year of life, you even see it in later life.
Okay.
Because children who were breastfed, especially those who were exclusively breastfed, in later life, in their 40s and 50s, they've been found to have lesser incidence of obesity, heart disease, and hypertension. And so they are less likely to die.
So the foundation for a good life,
yes,
both in quality and the length of life, is actually laid at infancy, and it has to do with breastfeeding. Yes. But one has heard, especially with the emergence of modern-day diseases like HIV and the rest of them, that there are instances where you may not breastfeed. Talk to us about that, because, I mean, one has heard some conflicting, stories too about the possibility of an HIV-positive mother breastfeeding their child too. Enlighten us on that. Yes.
When you talk about contraindications to breastfeeding, that's things that will not allow a baby to breastfeed. You have what we call the absolute. That means that baby cannot breastfeed.
Okay.
And then you have the relative ones. Now, the absolute ones are very few. One of them is what we call galactosemia.
Which is?
Inability to digest lactose in breast milk. But it is very rare. Babies who take that, they won't be able to tolerate who have that condition, will not tolerate breast milk. Now, if the mothers are on some drugs, like drugs for Parkinson's, epilepsy, there are certain drugs. Mothers who are being treated for cancer, because these drugs are secreted in breast milk.
Okay.
So we don't want them getting to the baby. Those are absolute contraindications. Mothers who are on cocaine, who take marijuana, we also do not encourage them to breastfeed. But those are the absolute contraindications.
Yes.
Now, the relative ones, that's where HIV comes in. What is expected? You know your HIV status. These things are planned. It's not everybody who is HIV positive who is going to be on HAT. Those are the drugs for HIV. But I'm ready to have a baby. You meet your doctor. They start you on HAT.
Okay.
So that these babies are protected. And then at delivery, you also have a drug that the baby will take for the first 6 weeks of life. That's all.
Okay.
Now, even if you pick that woman, maybe you didn't pick them on time, like a lot of our mothers come in labor, and that's when you even see that they are HIV positive.
Yes.
You will start the mother on HAT. Babies will still breastfeed.
Okay.
And there's no more discrimination like before, where we used to say, you do exclusive for a few months, and then you switch over. Now they're like any other mother. They exclusively breastfeed their babies for 6 months, and then they switch over to complementary feeding. So they're just like any other person.
Well, what about some women that don't just get to lactate? Their breasts are not producing milk.
Those are very, very rare conditions. I've heard people say that. But you see, the number one thing that you need to breastfeed your baby is that willingness, that zeal. The main impetus, will I say, for breastfeeding is actually sucking.
Okay.
It's sucking. It's a reflex.
As a baby is sucking.
Yes, the more the baby sucks, the more the milk will flow. So for women who want to have successful breastfeeding, you start. And that's why WHO and the Federal Ministry of Health has said that you should start breastfeeding within the first 30 minutes of life.
But then what happens when you get someone like that? Because I knew someone like that in the past.
You mentioned foundation initially.
Yes.
That foundation was not well laid.
Oh.
Because you start, and it's so beautiful to watch. A baby who comes out screaming. 30 minutes is on the breast. In fact, on their own, they are looking for the breast. Because now we deliver babies on the mother's abdomen.
Yes.
Before you deliver the placenta. So while they're on their own, because the breast milk gives out a sort of smell, they are searching, they are rooting, and then they latch on. And they start, even on their own, without anybody helping them.
Okay.
So,
and unfortunately, we hear that only 25% of Nigerian women or mothers give exclusive breastfeeding to their children. Talk to us about how really important it is. You know, I mean, we cannot overemphasize the importance of breastfeeding and the dangers of not breastfeeding.
Okay. I would want to say that the rate has even increased in the last 4 years.
Okay.
It was previously 17%. Now we've gotten up to 25%. But it's still very low. That survey also showed that over 40% of mothers actually do what we call predominant breastfeeding.
Which
whereby they breastfeed and then use
baby formula.
Water.
Water.
Oh.
It was even more of water.
Oh, okay.
Because Nigerians, we have this idea that breast milk, you won't ask a mother whether she has breastfed. They usually say, has the baby been fed? Has the baby eating? So we see breast milk as food. And so naturally, it's just like, oh, anybody who eats must drink water. So when you say don't give water, it looks somehow.
Yeah, it's tough for some people to accept. I mean, you hear mothers. I recall telling a young lady, you know, not to add water to her exclusive breastfeeding, and her mother was like, "No, I mean, we always gave water to our babies when they were born. I mean, how do you say a child will not take water for all of 6 months? How possible is that? What does the water do? Is it a case of diluting the breast milk, and so the baby does not get the kind of nutrients it should get from the breast milk?
Okay. You need to remember that the capacity of the stomach of a baby is actually very small.
Okay.
60 mils, 90 mils. And so when you go ahead and you give 20, 30 mils of water, how much food? Remember, water does not have anything. It has no calories, it has no nutrients. It's actually empty. And so you are diluting that feed that the baby is supposed to get. The good thing about breast milk is that it's actually 80% water. That's the good thing about it. Because I tell mothers, okay, if you close your eyes, you put breast milk in a cup, you put water in a cup.
Can you differentiate?
And they pour it on your hand. You can't tell the difference. So that tells you that this thing is actually has a lot of water already.
Okay.
So there's no need. And you're actually doing a lot more harm than good. So if we actually remove that water, then we'll actually have our exclusive breastfeeding rates rising to as high as 70.
But for a country like Nigeria, that it seems quite difficult for working mothers to be able to breastfeed their children exclusively, even though many of them really desire to, but they cannot because of course, obvious reasons. They have to work, they have to resume after 3 months and all that. How can they work around it? Is it even possible?
We always encourage workforces to have a breastfeeding room, a crèche. Most organizations will give at least 3 months for your mat leave. Lagos State has even gone a step further to give 6 months.
Yes.
So throughout the period when you're supposed to exclusively breastfeed, you are on leave. So it's not a problem. But for others, 3 months, and then you have a breastfeeding room where the mother, you put your baby there. If you need to get someone, it can be sorted out. It's just that push to have a room where a mother can easily leave her workplace, 15, 20 minutes, you go breastfeed.
So it's important for the workplace to be more baby friendly.
Yes,
as,
we need to
you know, as this becomes more important. All right, joining us from Abuja studio is the head family and reproductive health, World Health Organization, Nigeria, Dr. Andrew Mbewe. Thank you so much for joining us this morning on the show.
Thank you very much.
Yes, indeed. Now, talk to us, you know, very briefly, if you can, about the difference. How much difference, really? What's the difference between breast milk and baby formula? Because it's still very difficult to convince mothers, families, you know, that baby formula may not be the way to go when it comes to providing that essential nutrition for babies in the early life.
I think the baby formula is basically an imitation, and breastfeeding or breast milk is the real thing. And God has given us a perfect material for us to feed our babies, and therefore there is a difference in the baby formula, and also in the formulation, and also in the reconstitution of the formula. Many things can go wrong. There can be contamination, and also the people who produce them, there can be some mistakes. But with breast milk, I think it's the best thing, that the baby is the natural thing.
All right, Doctor, we need to work on the audio there. We're having some technical issues with it. We'll get back to you as soon as that challenge is fixed. Let's come to you now, Dr. Oluwabi. What really is the difference between a breastfed child and the one that didn't get breastfed and grew up? Because we've heard arguments of parents saying that for one reason or the other, or maybe maternal mortality, this child wasn't breastfed and grew up to be a healthy person.
The breast milk substitutes, like Dr. Mbewe was saying, is an imitation. Now, you know that most of those milks, they're from 0 to 6 months. Breast milk is designed in such a way that it changes with the baby's needs.
Okay.
Because what a baby needs at 1 month is different from what it needs at 2 months, at 3 months. The period of fastest growth is actually in the first 6 months of life. Babies actually double their weight. That doesn't happen any other time in life.
Okay.
The first 3 months of life. So they need what will make them to grow well, especially the brain. It's not even just the body. It's also the brain. In later life, we found out that those who were exclusively breastfed were less likely to have obesity, heart disease, and hypertension. We've also discovered, several studies have also shown, that the breastfed babies actually have a higher IQ compared to those who were not breastfed. There are several studies to that effect. And so they grow up to be better adults. Society, economic value is more what they put into the society.
Yes.
So those are things that we have shown over time. I know there are situations where mothers cannot breastfeed, but that breast milk is actually complete.
Even talk about the cost benefit of breastfeeding.
That's very, very important.
Because baby formula, the average baby... Okay, let's take it to Abuja. We hear that Dr. Andrew Mbewe of the World Health Organization is back on the line. The audio hopefully is better now. Dr. Andrew Mbewe, you were talking about, you were trying to make comparison, you know, based on the question I asked you, between breast milk and baby formula.
There is definitely a difference. The baby formula is an imitation of breast milk, and the breast milk is the real thing, if we may put it simply like that. And also, if I may put it as, God has made the breast milk to be perfect for the child who needs to be breastfed. While baby formula, although it has the constituents of what is in the milk, but it's not everything. It's not everything. And as I said, it's an imitation of what is in the breast milk. And also, there are also other dangers that may come in while you are providing the formula, the way you prepare it, the waters that you use, the hygiene of the person who is constituting it. All those things can go wrong, but we know that the breast milk is the best. It has enough water, it has enough substances that can protect the baby, and also it is the best that has been identified for a child to take the breast milk up to 2 years.
All right, some new mothers somehow, especially in the past, used to squeeze out the first liquid from their breasts before giving it to their babies. And then later on, there was a campaign that, in fact, that was the most important one. So tell us how important the colostrum is.
Okay. The first part of the breast milk, if I heard you correctly,
yes,
the first part of the breast milk, which is the colostrum, which is the thick one, is one that contains all that you need, the antigens, the antibodies, as well as the things that the baby really needs to be protected. Some people call it the first vaccine for the child. And therefore, the colostrum, or the first substance that comes out of the mother's breast, is very key, is protective, as well as it has a very high nutrition value, and therefore it should not be discarded, and it should not be ignored, and it should be given to the child, to the newborn.
Okay, Dr. Mbewe, let's put you on hold, and of course our guest in the studio as we talk about Breastfeeding Week. We have breaking news for you at this time. Operatives of the Department of State Services, DSS, have blocked all the entrances into the National Assembly.
Well, they are turning away cars of lawmakers and one of those that have been prevented from gaining entry into the National Assembly. It is not clear, yet clear, of course, what the agenda of the meeting was about, and no explanation has been given for why the security agencies turning back National Assembly staff and lawmakers.
Yes, indeed, and we'll bring you, of course, updates in our news bulletins.
Indeed.
Yes, okay, let's... All right, thank you very much. We still have our guest, Dr. Andrew Mbewe of the World Health Organization in our Abuja studio, talking to us about, well, making comparisons between breast milk and baby formula. But let me ask you this question. Yes, we have talked about the benefits to the child, the baby. What about the benefits to the mother? Because we've heard that there are benefits when it comes to postpartum depression, you know, breast cancer and all of that. Expatiate on this for us. Dr. Mbewe?
Yes, please. I missed the last part, but
okay, talking about the benefits, let me just, okay, the benefits
for the mother.
Exactly.
Yes. I think the benefits for the mother are many. One is definitely it improves the bonding of the mother to the child. Secondly, as already mentioned, that it has, it at least helps to prevent certain cancers to develop in the mother. But also when the child starts breastfeeding, it helps to it's also like a contraceptive. At least the woman may not be able to conceive immediately, and also it helps in the womb in contracting because of the hormonal release, and therefore there are many things that and the many things that benefit the mother herself other than the baby. But those, there is definitely, it increases bonding, and also it has benefits on the mother. Immediate, there are some which are immediate and others that are long-term, and therefore breastfeeding is beneficial to both the mother and the baby.
All right, Dr. Mbewe, we'll get to you in a bit. Stay with us. We have joining us on this same topic, of course, in the studio, Fumilola Adewumi. She is a nutritionist. Good morning to you, Fumilola. Thank you for joining us.
Good morning.
Now, what kind of food should a lactating mother ingest so that she can breastfeed well?
We do encourage a lactating mother initially to have prepared for lactation even before delivery by taking adequate nutrition. So immediately after delivery, you ensure you increase the fluid, especially from pap, adding of soya beans, which serve as antioxidants and also helps the lactation. And at the same time, you can take more of yogurt, take more of what we call konuzaki. Those things, yes, it helps lactation. So the more relaxed the woman is, the more the fluid intake, and at the same time adequate diet that can help the lactation.
That's very interesting. But let me stay with you, Fumi. Like we established earlier, before you came on, there are mothers who have difficulty lactating. What exactly is at the root? Have you been able to discover, to say this is what causes many women not to lactate, and how do you now change that?
What I will always use my hospital as an example.
Okay.
We normally give lectures, health education preparation in lactation. What we do is that we ensure that they would have prepared their breast, ensuring that the breast is not inverted, or yes, the breast is not inverted, and of course the woman is eating well. Then we would have examined the breast to be sure of the state of the breast. Okay. And of course, the state of the health status of the woman is so important. Most of them, psychologically, they are not prepared for breastfeeding.
That psychological aspect is very important.
Key because the transition from being a single person to being a mother, being responsible for a life. All right, Dr. Oluwabi, what can be done, especially by the mothers? Modern-day mothers especially, for them to be able to make the most of the first 6 months of their baby's lives, to be able to give the best and then take care of themselves, because we understand that it is when you are healthy that you'll be able to take care of your baby.
Okay. We'll prepare them from the antenatal period, like she said. Psychologically, we show them the techniques that they should use. Support them. That first 30 minutes of life, like I said, is very important. Allow baby to latch on and start breastfeeding, and then you support her all through. We keep encouraging. She's well hydrated, she's well fed, and then that psyche is very important. If there are obstacles, maybe stress, you may even need to bring in the husband, bring in the mother-in-law. You need to help this woman, especially for the newer ones. Now, for those who even want to breastfeed and they have to go to work, you can actually express your milk. When you express breast milk into a cup, it can stay. You don't need the refrigerator. 6 hours on the table, and you don't need to warm it. Please, we don't warm breast milk. Because when you warm it, you denature the protein in it. Rendering it useless. If you put it in the fridge, it can last for 24 hours. So when you bring it out, you allow it to warm naturally. You don't put it in warm water like
room temperature.
Allow it to come to room temperature by itself. So for those who are going to work now, you express as much as you can in the morning, and then as soon as you come back, allow the baby to breastfeed. Like I said, it's a reflex. The more the baby feeds, the more the milk will flow.
All right. Okay, and of course, we do need the right kind of environment to be created for all of this to happen. Let me take it to Dr. Andrew Mbewe very quickly. From the point of view of the World Health Organization, what exactly can governments do, both at the national and subnational level, to encourage breastfeeding? We hear that government is already looking at increasing, the federal level, the leave period from 4 months to 6 months. In addition to that, what would you advise governments to do to encourage this so that we have a better society in future?
Yes, I think the government can do many things apart from the policy that is being reviewed, and I think it's important that the woman stays at home at least for 4 months. I mean, for at least a good time for her to rest, as well as to provide the breast milk adequately, and therefore the government has a duty to provide an enabling environment by giving a proper policy. The other thing that the government can do, and also not only the government, but also many working places and employers, is to make available space for those who are working, who are able to, while they are working, they can easily go to a space within a building, a crèche, where the woman who is breastfeeding can quietly go and breastfeed their baby. Mm-hmm. And also the government can again encourage, provide a way in which they can pass on the information to mothers. For example, what you are doing at the moment as a TV station is very beneficial to women. The government can do the same.
What are those foods or substances, liquids that if lactating mothers ingest them, they would impede lactation?
Most times we promote the intake of pap, tea, but we realize that some children do react to tea. So when the mothers take such tea, you can observe the children having more stooling. So depending on the state of the mother, what is good for your system, that is what you consider.
Does cold water affect lactation?
No, it has nothing to do with that.
Okay, Dr. Luabi, we're going to talk about the economic value, you know, especially for poor populations. What advantage does breastfeeding bring?
Okay. On the average now?
Yes.
About the pack of infant formula, it's like 2,000 per...
One can?
Per can.
It's even more than that.
I just said on the average, some are cheaper.
I've had to buy. In some cases, 4,000, 5,000. You're like, what?
That's the average.
I'm just saying 2.5.
Aha.
So, the one in the first month of life probably will take about 4 cans. But as they grow bigger, they need more. So on the average, you could be spending as much as 50,000 if you're not careful every month. Remember, it's not just the can now. You need bottles, you need cups, you need the nipples.
Yes.
You need water, and you need your carrier. I love mothers who breastfeed because I just, you see a lot of them on the road. They just they carry their handbag and they carry their baby, and they're fine.
All right, Dr. Mbewe, quickly now, what should be or will be the focus during this breastfeeding week? Because we've had, first off, cases of some people not even liking the idea of seeing mothers breastfeeding their children publicly.
Okay. Yes, if I heard you, the emphasis, at least this this breastfeeding week, is that we're trying to emphasize for the mother to breastfeed in the first to start the early initiation of breastfeeding within 1 hour, and also to exclusively breastfeed up to 6 months. And we encourage that at every opportunity the mother should do this, and for the benefit of the baby. And I think what we can encourage our mothers through different media, not only television, but we hope that the messages about breastfeeding can trickle down not only in the urban area, but also in the rural woman. We take it for granted that women know, or those who have babies know about breastfeeding. Most of them are ignorant. Not only rural women, but even the educated women may not know everything about breast milk. And therefore, WHO is doing its very best to work with government to see that the women are knowledgeable about the benefits of breastfeeding, as well as for them to know when to breastfeed and when to exclusively breastfeed, and not to stop breastfeeding after 6 months and to continue until up to 2 years.